The patient has decided the knee replacement is the way to go. And many people just want to know, how fast am I going to get back on my feet? Before surgery, what can a patient do to ensure that they have a smooth recovery?
The old adage that we are what we eat, it's super true because, if you have a really well-balanced diet, as far as healing goes after the surgery, you're much more likely to heal faster, recover quicker. Your immune system is very important to have at an optimum level so that you can, make sure to fight off any complications like infection or things like that. It's actually proven that the better range of motion you have prior to surgery, typically the better range of motion you'll have after surgery. But also something to consider, and it's not always something that your insurance would necessarily pay for, but there's something called pre-hab, which is going in and getting pre-evaluated by a physical therapist before your procedure, before your replacement.
You mentioned how a good diet, just changes in your daily habits will be good going into surgery. But what are some habits or things one should avoid before surgery?
It's quite clear that if there's something that specifically aggravates your arthritis and makes
Mhm.
it more inflamed leading up to surgery, you should really avoid that. Like, for example, if you're like, oh yeah, I can't golf anymore. If I try and golf, my knee, I pay for it for the next several days. Well, you probably shouldn't golf leading up to your surgery.